What's up, guys? How's it going? Happy Sunday. It has been such a lazy Sunday for me, but I'm excited to jump on with my girl, Emily. She's actually one of my clients who is a nurse practitioner specializing in sleep. And mainly sleep disorders. And I'm really excited to pick her brain, learn more about all the kind of advancements with regards to kind of sleep treatment and everything. And look, I found her. She was super nervous about how am I going to connect. I love to drag people on this platform. There she is.
Hi.
What's up, Emily? How are you?
Hi, I'm good. I'm good. Thank you. Can you hear me okay?
I can hear you perfectly. Look at that. Usually my connections are not that effortless. So we did good. We did good. Yeah, I was just kind of everybody's jumping on, joining the call right now. And I was just telling them a little bit about our topic tonight. We're going to talk about sleep, the importance of sleep, how it could be impacting your weight loss, and specifics around sleep apnea and all of the kind of testing that we can do. Awesome. So yeah, I'm really excited to have you. I've got like a little bio that I want to say for Emily.
Sure.
Again, one of my lean clients. She's a board certified nurse practitioner and a member of the American Academy of Sleep Medicine. She's got a background in critical care and has been immersed in pulmonary and sleep medicine fields for the past 5 years. She knows a lot. She knows a lot. She's seen it all. As a sleep health clinician, she has screened, diagnosed, and successfully helped thousands of patients with sleep disorders, which, let me tell you guys, if your sleep is impacted, it impacts your health in so many different ways. And I was actually talking to Emily on Friday, and she was saying about how, because I was telling her about my Aura ring, and she was talking about how all the advancements and kind of like, wearables and stuff have really kind of exploded this field in sleep. So welcome, Emily. Emily is in Hawaii, right?
Yep. Yeah, I live on Hawaii. Yeah, so it's 2:00 in the afternoon here. So I know you guys are getting ready for bedtime over there on the East Coast. So
that's right. Well, give us a little background, you know, with regards to sleep and all the things.
Yeah. So just to tell you a little bit kind of more about my background. So like you mentioned, I am a critical care nurse. So that was my, beginnings of my career, working in the ICU, both in the pediatric ICU and adult. And it was during that time where I was forced to work night shifts, right? 12-hour night shifts, that I realized how much that was impacting my sleep and the way that I felt and my health. And then also for my patients, it was like, the one thing we do not allow people to do in the hospital, which they absolutely need for their, is essential to their healing process, is good sleep, right? Yeah. So in the ICU, it doesn't matter if it's 3:00 in the morning or 3:00 in the afternoon, it's all the same. It's bright lights, it's bells and whistles, it's pain, it's poking, it's people all around. And I really saw the way that would impact my patients. I mean, there is a very real phenomenon called the ICU psychosis. And it's basically a sleep deprivation delirium that people experience. And I kind of became a champion of sleep at that time. So people would call me the general where I worked. And I would literally sit outside of my patient's room for 2 hours. And I didn't care who it was. I didn't care if it was the doctor, if it was the family member, physical therapist. Like, nope, my patient's getting 2 hours.
Is necessary. Yeah. Turning all the buzzers off and everything. Yes.
Yes. So, and I found that that was kind of at a time that a lot of hospitals were starting to implement this, like quiet time. That patients could have in an uninterrupted sleep. So fast forward, years, and I went back to school to be a nurse practitioner because I was like, what am I doing in this ICU? I want to practice upstream. I want to help people. I'm tired of, and we save lives, but I wanted to focus more on upstream healthcare rather than sick care, right?
Right.
So I kind of lucked into the sleep medicine field. I had a relationship with one of our docs that I worked with. He was the medical director, and he had a practice, pulmonary and sleep medicine, and he was looking for a nurse practitioner, and we had a very good working relationship. And I was looking for something. So like I say, I kind of lucked into this. But honestly, the more that I have learned and the deeper that I dive into sleep, the more and more I fall in love with it. And I think that it's just so awesome because everybody is really starting to be, there's this huge awareness about the importance of sleep and our health. And it's awesome. Like I said, yeah, the wearables, I mean, that is like a whole new subset of people that are coming to the clinic because their Oura Ring, their Whoop, whatever is telling them they're not getting good sleep. So they're showing up in our clinic like, hey, what's up with this? I'm getting a bad sleep score. And we're, you know, uncovering some sleep disorders, whether it's sleep apnea or, you know, insomnia, restless legs. Those all play a big role in our health. So there's actually a gentleman who he's just a total phenom. I admire him so much. His name is Matthew Walker, and he's a professor, a PhD professor out of Berkeley. He's actually a British guy. He's got a beautiful accent. And he says sleep is the elixir to life. And you know what? I love that because it's true. I mean, sleep is truly, it is the nature's way. It is the nature's miracle potion that allows us to reset our bodies and our brain every day. So every day. And so, I mean, it is essential to survival, right? So, and we see the effects of poor sleep, whether it's sleep quantity, if you're a short sleep, you're only getting 4 hours of sleep because you work in 2 jobs and you're busy, or even like if you think you're getting 8 hours of sleep, which the average American or average adult should get, 7 to 8.5 hours of sleep. You might think you're getting 8 hours of sleep, but if you're not getting the quality sleep you need, that also impacts you tremendously. So
can you talk about kind of like all the stuff that happens while you're asleep, like all that benefit, all of the stuff that should be happening every night when we sleep?
Yeah, absolutely. So sleep definitely affects every cell, every tissue, every organ, every body system, right? So when we go to sleep, and I'll try not to nerd out too much on this because I can get really technical. But I'll try to just kind of keep things brief and simple.
Keep it simple. We got to understand it.
Yeah. So I know that everybody's heard about the circadian rhythm, right? The circadian cycle, and that's our 24-hour cycle that we go through. But then we also have this ultradian rhythm, and basically that's our sleep cycle, okay? And we have 2 parts of sleep. We have our non-REM sleep, and we have REM sleep, which everybody knows, rapid eye movement, which people refer to as dream sleep. And non-REM sleep is then divided into 4 different levels of sleep, starting at the most shallow level, and then stages 3 and 4 being deeper levels of sleep. And during the night, we need all of these levels of sleep in a certain kind of what we call sleep architecture in order to be completely refreshed. So interestingly enough, I think it was like 2012, 2013, something like that. There was this discovery of, it's called the glymphatic system. And I mean, we all know about the lymphatic system, right? Well, this is the glymphatic system. And basically what this is, it's our waste disposal system in our brains, okay? And it is primarily only active at night while we're sleeping. It's pretty much dormant during the day. So if you are not getting that good quality sleep and getting, completing the cycle many times during the night, you go through it about 4 or 5 times, depends on how long you sleep. It's about 90 minutes long. And it's during that time that this glymphatic system, our brains are just awash in this fluid that basically is removing all of the metabolites and the waste products and the plaques that are building in our brain throughout the day, right? From our neurons producing energy. So we now know in post-mortem autopsies in people with Alzheimer's disease, we see these amyloid plaques. And we now know there is a very, very strong correlation between Alzheimer's dementia and poor sleep.
And poor sleep.
Yep.
Yeah. Wow.
Yeah.
That's it makes sense for sure, but that's not always something I think about with regards to the importance of sleep.
Absolutely. Yeah. It's pretty amazing. And like I said, sleep does impact every system in our body. And so we'll kind of get into that a little bit more as we talk about sleep apnea and the consequences of sleep apnea. And so, just to give you a little bit of background, people kind of hear sleep apnea, obstructive sleep apnea, central sleep apnea. So for today's discussion, I'm calling it sleep apnea, but I'm referring to obstructive sleep apnea, okay? Central sleep apnea is something different, and that's not really what we're talking about today. So I'm just going to call it sleep apnea, but just to clarify, we're talking about obstructive sleep apnea.
Yeah, let's talk about like symptoms of like poor sleep, you know?
Yeah.
So, and again, I talk about, because I think that there's sleep and then there's quality sleep. And I mean, again, that I think that that is the huge power of wearables. So I have an Aura ring. Do you feel like, this is kind of a side question, when people come in with this kind of Aura ring data, does it typically correlate with something?
Pretty well, yes. So I think that the technology world has really advanced and kind of brought awareness to people about their sleep. And oftentimes, when people come in and like my Aura ring or my Whoop's telling me I'm not getting good sleep, then that's when you really need to be seeing a sleep specialist that can really, do some assessments and talk about what's going on and kind of uncover to find out, well, why are you getting a bad score, and then kind of guide you and figure out what's going on from there. Yeah, but yes, oftentimes, yes.
Yeah, well, that's really interesting. I mean, because I always say like like I struggle to get to sleep. Like once I go to sleep, I'm good. And I usually get a very good sleep score as long as I don't drink alcohol.
Yeah.
If I drink
alcohol, yeah.
Then I have a really, that's definitely the one thing that will always skew my sleep score. And then obviously, if I'm up late and stuff like that. But my husband literally like lays his head on the pillow and 30 seconds later is sawing logs. So he likes, so when he got his Aura ring, I was like, oh, your sleep score is going to be amazing. And it's bad, So, and I think it's because he's got sleep apnea with the way he snores and stuff like that. So it's really interesting because I think a lot of people may think that they have good sleep patterns, but are you really getting those sleep cycles? So it's really interesting that you kind of talked about that. So what are some signs of like, that you have disruptive sleep? Like what are the things that are going to give you that kind of negative impact with, poor sleep?
Yeah. So, I mean, honestly, I think I told you before, people usually come to find their way to my office one of three ways. And that's usually their spouse won't sleep in the same room with them anymore because they're being so disruptive. They're snoring, they're gasping, they're like, disrupting the other person's sleep.
Right.
The second way is, they're falling asleep inappropriately. So they're so tired during the daytime. They, no matter if they get 8, 9, 10 hours of sleep, it's not this quality, what we refer to as sleep efficiency. And so they're falling asleep inappropriately, whether that's at work on the computer, driving their car, some kind of traumatic event happens, or, their physician or their cardiologist sends them over to our office because they've had a stroke or a heart attack. So,
okay.
So let me just give you a little bit of background on sleep apnea. So sleep apnea is a mechanical problem. Okay. So it's what we call a sleep disordered breathing. Okay. So it's not necessarily a sleeping problem as far as brain waves go. It's a breathing problem while you're asleep. And when we go to sleep at night during REM sleep, our brain actually sends signal to the rest of our body to be paralyzed. And that is so we don't act out our dreams, right? And we're not moving around. So we are actually temporarily paralyzed in REM sleep.
Mm-hmm.
And our muscles, when we're asleep, are completely relaxed. Well, we have some very complex muscles in the back of our throat that work together to keep the airway nice and open, right? Now, when you're awake and alert, I don't hear you like snoring and gasping and choking and making all these noises. But in people who have sleep apnea, these muscles relax too much. And so that airway becomes disturbed in some way, whether it just becomes very narrowed or it collapses in on itself. So when that happens, and somebody has sleep apnea, they go to sleep, they start to fall asleep. And as they start to progress through the night and through their sleep cycle, they start to lose muscle tone and our muscles become more relaxed. Well, as you start to enter that stage 3, stage 4, really deep, restorative, beautiful, sweet sleep we need, boom, airway shuts. You stop breathing, or And the brain senses it, right? We've got these little receptors in our brain that are always monitoring the chemical composition of our blood. Bless you. So these receptors are always monitoring the chemical composition of our blood. And as the oxygen levels dip down and carbon dioxide levels rise, the brain senses that. And it sends out a huge distress signal. And it's like your sympathetic nervous system, your fight or flight just got triggered. So think about that, what's happening physiologically in your body with all those stress hormones.
Multiple times a night.
I mean, upwards of 100 and sometimes an hour.
Wow.
Yeah. So when that happens, stress hormones are released, cortisol, epinephrine, norepinephrine. It puts a huge strain on the heart, right? So it can cause heart failure, atrial fibrillation, very difficult to control blood pressure, bottom line, strokes or heart attacks down the road.
So this mechanical issue could be leading to all these other secondary issues.
You got it.
Wow.
Yep. 100%. Yes. And that is kind of, what is so awesome about being, working in the sleep field is that we are able to identify these people hopefully early on and prevent some of these, sequelae down the road.
Yeah.
So interestingly enough, as far as that cortisol spike goes at night, I have also been seeing a couple of diabetic patients who have or people in the health and wellness industry or, space who are wearing the continuous monitors.
Your insulin goes up.
Yep.
Yeah. We saw that when we did our wearables, the CGMs. You could see the cortisol response in the insulin. It was very interesting. Very interesting.
Yeah.
Let me ask just a couple of questions. Yes, this will be on replay, so you can watch it later. Lots of interesting stuff. My sleep apnea was the cause of my anxiety.
Yep.
And I can imagine that, again, when you're not getting quality sleep, it has this spiral effect on, cravings, on anxiety, on depression, on, again, your ability to lose weight, obviously your cognitive power.
Yes.
I could definitely see that. Can you cure snoring?
So that's kind of a loaded, tough question. So yes, you can, but you really need to be evaluated to see what's causing the snoring. So some people have a predisposition to have snoring or sleep apnea, obstructive sleep apnea, because they've got these big giant tonsils in the back of their throat that are blocking their airway, or they've broken their nose and they have terrible, nasal airflow at night. If you have poor airflow here, there's less pressure in the throat to keep it open. So it kind of depends what the cause of this snoring or sleep apnea is. Some people, 10, 15, 20 pound weight loss is enough.
Yeah, no, absolutely. To help
which is the easiest one to say and the hardest one to do, as we know, right?
Yeah. Mary, as if you dream, are you in REM sleep? So yeah, REM sleep is the dreaming sleep. And I love, because I actually just listened to a podcast on the 90-minute cycle. Mm-hmm. And the guy that I was listening to talked about how disruptive it is to actually wake up. It's talking about like waking up with an alarm. Like if you have the ability to wake up at the end of this 90-minute cycle, it makes a huge difference. So what can you explain that cycle a little bit?
Yeah.
Going through, basically we look at it as light sleep, deep sleep, REM sleep.
Right. So, and that's basically, that's what it is. So sleep architecture, when we bring somebody into the lab and really wire you up head to toe and get brainwave activity, what we see as far as the sleep architecture go, most people, it's a 90-minute cycle. And like I said, you start in a shallow sleep, non-REM sleep 1 and 2. And as you start to fall asleep, you get down into 3 and 4 into a REM sleep. And then after that, you kind of come back up. And it's this beautiful cycle all night long, right?
Yeah.
And so, yes, sometimes if you're waking up, I notice sometimes I will wake up and I know I have definitely woken up at the wrong part of my sleep cycle. I'm also a person, if I don't get like 8.25, 8.5 hours of sleep, I'm a wreck. So yes, there is something to kind of waking up at the right part of your cycle. And if you have the ability to just wake up naturally, that is going to be, you know, when you feel the best. Of course, not everybody can do that. We have to set alarms. But if you can get your sleep very regular, meaning
Right.
regular sleep time and a regular wake time, that is going to be your best bet for sure.
It really was. I think that someone said that is probably the number one thing that you can do to create the healthiest sleep cycle is to go to bed about the same time every day and wake up about the same time every day.
Yes.
I also believe that that sunlight exposure in the morning time is very critical too.
Yep.
Um,
Absolutely.
Getting that direct sunlight. I mean, again, not looking at the sun, but just being in sunlight within 30 to 45 minutes of waking can be really powerful to reset your circadian rhythm for sure.
Absolutely.
Okay. Anything about waking up in the AM with a headache?
Yes. So absolutely. So if you're having sleep apnea, oxygen levels tend to be a little bit lower when you're asleep, and that can definitely cause morning headaches. So people sometimes will tell me that they have like a very like intense headache, like a frontal lobe headache, that after they wake up, they drink a little bit of water, they've been awake for 10 or 15 minutes, you know, seems to go away on its own. Other people will say they just feel foggy, like a heavy brain fog, just very slow to start, difficult waking up. But yes, morning headaches can absolutely be one of the signs or symptoms of sleep apnea.
Apnea. Someone says 15 to 20-pound weight loss is why I'm here. I want my apnea gone. Yeah, exactly. Somebody asked, is falling asleep too fast bad as well? Is it a bad thing to fall asleep too fast? That'd be a good.
Not that I've ever heard. No, if you can fall asleep quickly, that's great. Although I don't know if maybe that comment was pertaining to what you were talking about your husband that you suspect also has sleep apnea. People who have sleep apnea have what we call hypersomnolence or daytime sleepiness. And so they're just exhausted. So it's very interesting. Oftentimes in men who have sleep apnea that's undiagnosed and untreated, we will see them, head hits the pillow, they're out like a light, but they have difficulty staying asleep. They wake up many times during the night and they don't really know why they're awake, right? I mean, 6,
Right.
7, 8 times a night, they're waking up. They don't know why. Oftentimes people tell me, oh, I'm waking up to go to the bathroom. It's like, no, you're not waking up to go to the bathroom. You're waking up and you're coming to a shallow level of sleep. Then you have an awareness. You're like, okay, it must be because I have to go to the bathroom. But interestingly enough, in women, especially menopausal and postmenopausal women who have sleep apnea, it will often manifest as insomnia. Okay. And that is because it's the brain's protective mechanism. Don't fall asleep, don't fall asleep, don't fall asleep. Right. And so it's really a shame because I see these women who've been tired for years. They've been struggling. They've been talking to their provider and they're like, I'm exhausted. I can't seem to get energy. And they're testing hormones and they're doing all these other things, or they're being kind of written off. Well, because you're working full time and you're a mom and you're doing all these things, of course you're going to be tired. And it's because they don't fit the stereotypical mold of an morbidly obese man with an 18-inch neck.
And that's really, because Emily jumped in my office hours one day and we were talking about sleep and she kind of chimed in and was like, ladies, you are just as prone to have sleep apnea as men. And again, I'm very bad about stereotyping that kind of like comorbidity, men have, sleep apnea. And I think that I see so many women that are like, I can't sleep, I can't sleep, I can't sleep. And we talk about, okay, well, make the room cold and we do all these things. And I feel like it's like we blame it on hormones. And I'm like, what if all these women just have sleep apnea and don't really know it?
So, yeah. So, I mean, honestly, I've got little teeny tiny little skinny darling little bean poles in their 20s in my office with wicked sleep apnea.
Did you just read Carl's comment?
Pardon me?
Can you see the comments?
Oh, I can't. I don't have glasses on, so I can't read them from that far away.
I had apnea when in my 20s and was super thin and fit. Still have it now in my 40s. So she's asking, what else can you do other than weight loss? So that's interesting that you say that.
Yeah. So, So I'm going to circle back to that just as we talk about. Yeah. I'm going to circle back to that just when we kind of talk about some of the treatment options.
Yeah.
and we'll make sure to answer her question. So I do just want to just quickly also review some of the effects of poor sleep and sleep apnea on our bodies. Okay, so besides the neurological system, which we already said could potentially lead to some dementia later in life, just poor concentration, poor memory, headaches, morning headaches, as well as migraine headaches, seizure disorders are often linked to sleep apnea. Cardiovascular, right? We said that. So during stage 3 sleep, it's almost like a natural blood pressure medicine, you know, this deep sleep. And often people will come to us because they can't get their blood pressure under control. They're taking 3 agents and that blood pressure is still through the roof. And when you measure it in the morning, it's sky high. So increases blood pressure, increases risk of cardiovascular events, strokes, heart attacks, atrial fibrillation. Our immune systems, right? Huge with COVID, huge with COVID. If you're not getting good quality sleep, efficient sleep, and quantity sleep, your immune system is not working, is not functioning as well. We see a drastic decrease in natural killer cells in people who have poor sleep, which natural killer cells are a defense against cancer too, right? So, and then mood, psychiatric health, right? If you're not sleeping well, you're irritable, you're agitated, depression, anxiety, interpersonal relationships, right? If you're irritable and irritated all the time, you're screaming at your kids and your husband and you're, you know, flying off the handle. The big one that usually gets the middle-aged men is our sexual and reproductive health. If you've got sleep apnea that's unaddressed, this is how I often get them on a CPAP machine. Erectile dysfunction.
You usually have erectile dysfunction. And, you know, that is, do you think that that has to do with that nitric oxide, you know, mouth breathing? Because breathing through your nose is so important.
Right. Yeah. So that may play a role in that. I've read a little bit of literature on that, but we definitely do know that men who have sleep apnea that aren't getting stage 3, 4, and REM sleep, which is very important. REM sleep, testosterone peaks right before REM sleep. So if you're having low testosterone levels, that can also lead to some major problem, and also estrogen in women. Unaddressed sleep apnea and the relationship between that and PCOS, which is our #1 cause of infertility, right?
Wow.
Yeah. Yeah, that 15 pounds, that insulin resistance, the nighttime sleep apnea that's driving cortisol and glucose and insulin response at night, PCOS, infertility, absolutely. Wow. So, I mean, yeah.
It's so important. It's so funny because we we make our kids sleep. You know, most of the time you're raising kids, it's like the most important thing. It's like, you've got to go to bed, you've got to sleep. I mean, I still have, tweens and teenagers, and I'm like, you got to go to sleep. Like, you're still like growing. Like, this is the most important thing. And I feel like
absolutely
we're all suffering with poor sleep due to phones and TV and stress and alcohol, all of those things. So
yes, so alcohol is a big one that really messes with your sleep, and it actually interrupts our and decreases the amount of REM sleep that we get. Alcohol, marijuana. The jury's still kind of out on the CBD thing. There's a lot of studies going on with that, but we definitely know that marijuana and alcohol definitely have an effect on our REM sleep.
On that 90-minute cycle. Yep. Yeah.
Yep.
So somebody asked how alcohol impacts, weight loss and sleep. And I mean, basically, all I can say is, just after wearing a wearable, it's, because again, before, if I'd have a glass of wine, I would be like, oh, no big deal. This is not impacting me, but now I can just clearly see where 1 4-ounce glass of wine, 1 shot of alcohol, tanks my sleep. I mean,
you're going to pay for it.
So I can just assume that it's going to impact the day after, how I'm going to eat, how I'm going to feel, and all of those things. So that's kind of, somebody asks about the alcohol and sleep. Let's see here. I'm menopausal and still have night sweats. A lot of people talking about like night sweats. Is that a sign of, sleep apnea?
It could be, just because you can have some what we call autonomic dysfunction with sleep apnea or with sleep disorders, for sure. I don't know. I'm starting to get to the age where I'm having those night sweats and it's killing me, especially in Hawaii. If it's cold, you close the window. If it's hot, you open the window. You know
Right.
what I mean? We don't have climate controlled environments over here. So
I think that that's one of those symptoms that it could go both,
yeah,
it could be a number of things. It could be, I will plug my chili pad. If you want my link, it's a game changer, especially for night sweats. Somebody asked what temperature should you sleep at?
65 to 69 degrees.
Okay, that's what I thought. I do 68, but
Yep.
so 65 to 69, dark room, all of those things, can kind of really matter. Okay, so somebody asked, is sleep apnea curable? So let's talk about how you test for it. Maybe talk about how we traditionally test for it and now advances in the, field to test for it.
Absolutely. Yeah. So in order to get diagnosed with sleep apnea, I mean, you do have to have a diagnostic test. Okay. So I think that has been a major barrier to people because they don't want to go sleep in a lab. And traditionally, you had to come to the sleep lab, you'd get wired up, 300 electrodes all over your body. We'd get brain activity, oculomotor activity, and all this muscle data. And that was kind of the gold standard to get diagnosed. I mean, honestly, polysomnography is what it's called in the lab, is still really the gold standard.
Absolutely.
But if somebody comes to me and they're not telling me anything crazy, like I'm not, suspicious that you've got a REM behavioral sleep disorder or, narcolepsy or something else more involved, I'm like, oh, this is straight up sleep apnea, no doubt in my mind. You can do a home sleep test now, which is awesome. It's basically a very stripped down basic sleep test. Now, it's great because you can do it at home in the comfort of your own bed. You pick it up at your sleep technician's or your sleep doc's office, take it home, do the test, drop it back off, you get the results. But the one drawback to that is that, it is a very basic test. So it's just looking for sleep apnea. So if there's something more involved going on, you do have to go kind of the old-fashioned route with a full comprehensive sleep test. But for most people, a home sleep test, if anything, it's a great place to start.
Is it black and white? I mean, like when you're looking at the data that it collects, is it very like sleep apnea versus not, or can you be like diabetic? I mean, how does that work?
No, so basically the data, the metrics that we're looking at are your breathing or your respirations, your oxygen levels, and your heart rate while you're asleep, right? So when we score sleep testing, we have to have some objective data to go on. And so what we're looking at is how many times per hour is that airway collapsing? I think I said before, it's normal to have some degree of sleep apnea, if you will, or relaxed airway when you're asleep. So what we do is we score something called an apnea-hypopnea index. Some labs will report it as a respiratory disturbance index. But basically, it's a calculation of how many times per hour is that airway collapsing, okay? Under 5, 1, 2, 3, 4 is totally normal. Anything over that, to the letter of the law, is sleep apnea. So we look at this kind of continuum, right? And then we also look at oxygenation and desaturations, oxygen levels. So kind of looking at the continuum, apnea-hypopnea index of 5 to 15 is considered mild. 15 to 30 is moderate, and anything over 30 is severe, okay? So that's how we kind of objectively quantify sleep apnea. And yes, we can get all that data from a home test.
Wow.
The other thing that we will sometimes look at is just a complete blood count, because and we do get a lot of referrals from primary care doctors who, their patients on their complete blood count, their hemoglobin and hematocrit levels are a little bit high. And they're like, what's going on with this? Now, for people like in Colorado and altitude, they just physiologically can have higher hemoglobin hematocrit because they're living at lower oxygen levels. But for us here at sea level, if somebody's hemoglobin hematocrit is slowly creeping up, this is such an easy way to test to see, well, what's going on with your oxygen levels to make your body respond and be making more red blood cells, right?
Right.
So basically the home sleep test, the in-lab sleep test, a complete, blood count. And then of course, we're also looking at, glucose and different comorbidities as well. But really, it's so easy to get tested. So if you or your loved one, you have a suspicion, If you have an HMO, you have to go to your primary care doctor and get that referral for your sleep specialist in your area. But just request. And most people are doing a home test these days. It's pretty widely available.
Cool. I
If you
didn't
have
know that that was, I mean, I don't know about you guys, like give me a hard thumbs up. I mean, did you know that you could do an at-home sleep test? Like I had no clue that
easy peasy.
that simple to kind of look at. And then, you know, if that becomes unconclusive, then spend the time and effort it would take to, you know, sleep in a lab.
Yes.
So let's talk about treating. Okay, so you've been diagnosed with sleep apnea. You know, what's next? I mean, I imagine that there's obviously lifestyle, you know, things that you probably recommend. Somebody asked about drinking a glass of water before bedtime. You know, I mean, so maybe
Not gonna do a darn thing.
yeah, some of the things. I think if you drink a glass of water and it makes you wake up to pee every night, that's probably not a good idea. You know.
Yeah.
But what are the kind of the treatment options out there? Because I think that that's the next scary thing is that people are like, okay, well, I know I have sleep apnea, but I don't want to wear the, you know, the Darth Vader mask. And I know that kind of technology has come a really long way as well.
Absolutely. And that is the next big barrier that people come to my office and like, oh, I don't want to do the sleep test because I don't want to wear that CPAP machine. I'm like, you know what? You're getting way ahead of yourself. Let's do the test. Let's get some results. And then we can kind of decide where to go from there. But yes, so a CPAP machine.
Oh, I lost you. And this happened to me once. I can't hear you. Oh, there you are.
Can you hear me now?
Yes.
Okay, sorry. I was getting a call. I was trying to get rid of it. So CPAP is definitely the gold standard, okay? And it is definitely the recommended treatment for anybody that has like moderate to severe apnea, because if we can get you adjusted to it and we can get you sleeping well with it, it works, okay? And what it is, CPAP stands for continuous positive airway pressure, okay? And so it's a small little machine that sits next to the bed. It's quiet. It's like white noise, you know, it's like a fan. And it's got a tube with a mask at the end of it. And there's a million different kinds of masks out there. And the masks have come a long way. I mean, they used to be like giant, you know, full face masks. Now they have little masks that just kind of plug in the nose. Mm-hmm. I mean, yes, it's not super sexy. Nobody wants to have to wear a CPAP machine, but you know what? This is what I tell my patients all the time. You know what's not sexy? Having a stroke and being paralyzed on one side.
No, and ultimately, I mean, do you have to use it forever, or could you get to the point where you get healthier, you have a healthier lifestyle, like maybe you lose weight, you get your tonsils out, like you could get off of it, or?
It depends. Yes.
Okay.
Yeah. So CPAP will work for everybody. There's also a surgical intervention that people can look into, the ear, nose, and throat doctor. Not everybody's a candidate for it, but if your sleep apnea is caused because you've got big old kissing tonsils in the back of the throat, or you have zero airflow through your nose, getting that removed, or this, I mean, people do some crazy things. There's a surgery, a pretty invasive surgery. It's called a UPPP, where they basically shave out the back of the throat, take out the uvula and everything, and kind of sculpt the back of the throat so the airway's bigger. I mean, and some people, they would rather do that than be tied to a machine, you know? Yeah. So CPAP maybe not be forever, but it depends on, you know, what's the cause of the sleep apnea. Right. If it's, you know, I also have patients who come to me because they're going through the evaluation for a bariatric surgery, right? So this is now one of the steps in our state that the payers have the patients go through to do a sleep test, because it helps tremendously with their weight loss. It helps tremendously with their recovery. So I tell them, let's get you tested. If you need a CPAP, let's do it. Come back when you hit your goal weight, you know, in 8 months, and we'll retest you.
If you feel miserable, and that's what someone said, was like, I don't care to wear my big ugly CPAP because I feel so much better, you know, when I use it. And that's the thing is, I mean, if you don't know what it feels like to have restorative, quality, life-changing sleep every night, it could be the very thing that's holding you back. Now I'm working with a one-on-one client, and she struggles with consistency. And she struggles with consistency with regards to kind of craving sugar and like salty, like, you know, and basically we nailed it down 2 weeks ago that it was her sleep, that she could now correlate this viral effect on, you know, the nights where, you know, she had a couple of nights where she didn't get good sleep. And I'm like, okay, well, we need to stop working on, you know, this, and this, and we need to solely focus on improving your sleep, because fixing this one area in your health could positively impact every. Yeah.
Yeah. So, uh, you know, as far as the other treatments go, I know nobody really is really excited about that CPAP option. But yeah, you know what? When you feel better, if you can get on a CPAP machine and you feel better, I think that people they just normalize their lives, right? And so you just learn to just like, oh, I'm just a tired person. I'm just sluggish. I just this, I just that. But it's like, no, when you correct their sleep apnea and they're getting good quality and the right quantity of sleep, that's why I love what I do, honestly, because people come in and they think I'm like brilliant.
Yeah. And
people
I think
come in, they're like, Emily, oh my God.
What's the difference between a CPAP and a BiPAP?
So honestly, it's basically just the pressures that it delivers. And the old school CPAP machines used to just boom, blast you just one pressure, continuous pressure, right? The newer machines are these auto-adjusting machines, so they're very comfortable for people, and they're very well tolerated, to tell you the truth.
Yeah.
So just quickly, other possible treatments. So we talked about possible surgical intervention on the airway, CPAP machine, weight loss, and lifestyle modifications, right? There are some other very exciting, it's exciting to me, very exciting new kind of technology coming down the pipeline. There's some nerve stimulators. So we talked about it's a problem that these muscles relax, right? These the nerves don't stimulate the muscles to keep good tone. So there's one company that came out as FDA approved called Inspire Sleep, and I tell people you can almost kind of think of it like a pacemaker for the heart. Okay, so it is an implanted device, but they go in under the collarbone and kind of wire up the back of the throat, and then that way you have good muscle tone at night, and it prevents the airway from collapsing. It's totally internal. You're not hooked to a machine. You know, it is invasive, but it's just like a in office procedure.
Right. Interesting.
Yeah, so that is available in a lot of places. Ear, nose, and throat docs put those in, and then you know, people kind of freak out about that being internal implant, right? But there are other technologies coming. There's one that they're looking at that's like almost like a hearing aid that you put in that sends a signal here.
Mm-hmm.
So there are other treatments coming down the pipeline. Not quite ready for prime time yet, but they're coming. There is a new one that you put in your mouth, and it does something, tighten muscles. I can't remember the name, Excite OSA or something like that. It's fairly new on the market, FDA approved. I've been contacted by the rep, but with COVID, I haven't gotten a chance to meet with them.
You know, and because I worked in a clinical setting with, you know, morbidly obese clients, that most of them had sleep apnea. Mm-hmm. And somebody was commenting, you know, here, like, I hate my CPAP. The mask doesn't fit me. It's so uncomfortable. And I would just tell them, I was like, you've got to keep going back. Like, you've got to try all the different masks. You've got to try all the different pressures. Like, don't give up, you know?
Yeah.
What do you have to say about that? Like, is this person maybe sitting with some like really old stuff that maybe there's a lot of advances, or do you see that often where people struggle in the beginning?
I mean, potentially it could be, you know, that they just need their pressure adjusted, or they need to try a different mask. And honestly, the mask is 90% of that piece of the puzzle, right? Because if the mask isn't comfortable, you're not going to wear the damn thing. Right. It doesn't matter. It does not matter. So I tell people, like, I have some samples of masks that I give to patients when I have them, but I tell them, keep going back to that DME or whoever you got your machine from, and keep trying different masks. And everybody will tell you, like, oh, I have CPAP, I have a CPAP machine, and I use this mask, use the mask I have. And I tell people, don't do that. No, because what's right for one person, it might not be right for you.
Right, yeah.
So, or they might need to have their pressure adjusted. So that's where it's really important to have a good relationship, a good working relationship with a sleep clinician that you feel comfortable with. because they're not going to give up on you, so you don't give up on you.
Yeah, it's not like a one-time thing for everybody, you know. And like I said, the outcomes, really help, are really worth it. Okay, let me go through a couple of questions and then we'll kind of wrap it up. Everyone's saying such great information, so informative. Yeah, people are saying I struggle with, I have a hard time sleeping. What should I do? Well, potentially, if you've done everything, just make sure you don't have sleep apnea.
Yeah.
Someone was asking, how does my husband's snoring and sleep apnea impact me?
Absolutely. If they're waking you up during the night because they're snoring and choking, absolutely. That's why I say the number one cause of people to come into my office is because their spouse says, get out, you're out of here, go sleep on the couch, or they've moved to another room. Yes, absolutely. And I live with an insomniac. My husband is a terrible sleeper. And I mean, some nights I'm like, dude, seriously, like, and I've had him tested 3 times for sleep apnea just to ensure. He's an insomniac. But yes, his poor sleep and his iPad coming on and illuminating the room at 3 o'clock in the morning, I can see that through my eyelids.
Oh, 100%. 100%.
Yes.
Yeah, definitely. Somebody's really kind of caught up in the skinny versus fat sleep apnea. And I think at the end of the day, it's a mechanical issue regardless of weight.
What do you mean they're caught up in? What's the question?
Well, she's just like, because the stereotype is an overweight, obese male is going to be your classic sleep apnea. And she's like, I'm super skinny and have sleep apnea. Why?
Yeah. Well, the muscles are just relaxing too much.
Yeah.
It might be a genetic predisposition. I mean, we do see family members often in the same family, right, that have, a lot of them have sleep apnea. It's just, yeah. I mean, if you don't have big tonsils, you're not overweight, you don't have some of the other risk factors, I'm sorry, your muscles just relax too much. So maybe you would be a good candidate for a nerve stimulator.
Yeah. Yeah, definitely. I love it. Yes. So many people are just loving that. I love this information. Like I said, I have ordered Hunter's at home sleep study. So he's going to be my guinea pig. I'm diagnosing him with sleep apnea based on his Oura ring and how much he snores at night. I'm about to kick him out of my room. So, look, Hunter just jumped on and said, "What?" First he's hearing about it. Get ready, honey. Yay.
Yeah.
But yeah, we'll just kind of show you how simple it is. And women, again, this is ever since Emily spoke up in office hours and just brought this to the forefront, because I always speak about, because I work with so many women who have that midsection kind of inflammation, fat accumulation, which is very associated with cortisol. And what Emily demonstrated very powerfully today is how that disruption in your sleep. I mean, basically, your body stops breathing. You have a fight or flight reaction to keep yourself alive. And that automatically spikes your cortisol. You do that 10 times, 50 times, 100 times a night. Again, it could absolutely be your missing piece to feeling your best. And, now when I talk to my clients about sleep, I'm always like, and make sure you don't have sleep apnea,
Yep.
I would be interested. I mean, I don't know if there's numbers out there about how many people in the typical population have sleep apnea. I mean,
So the according to the American Academy of Sleep Medicine, the last numbers that I saw, it is estimated that 40 million Americans have sleep apnea. Unfortunately, there's only about 5 million that have been diagnosed and treated.
Wow. 40.
So those numbers might be a little bit old. They may even be higher than that. But I'll tell you what, they're not getting better, because we see our society, we're getting bigger, and the numbers are going to continue to climb.
Yeah. And I mean, we're not getting better because we prioritize sleep the least, especially in our society, in our culture. We're all about work harder, work longer, grind it out, versus other cultures that really kind of take that nap and sleep and all of those things as a priority. So, well, thank you so much. I mean, kind of the last person, you know, a couple of people are just asking, how do we get the at-home sleep study information? And
So
at this point, actually, if you live in Hawaii, Emily, they can contact you, right?
yes, please, absolutely. Yeah, if you're in my state, where the doc and I are licensed here in Hawaii, yeah, we can put my email or contact in the comments. I'm sure somehow, I don't know, you know how to do all that.
Yes, I'll do that.
So yeah, I can put my contact information in there. Please call me. You know, we can do kind of a HIPAA compliant Zoom type meeting. I can mail you a device and easy. Unfortunately, I'm not able to service or take care of patients on the mainland right now. But just contact your primary care doctor. If you have an HMO, you need the referral.
If you have a PPO, you don't need a referral. You can call a doctor first and foremost. And like Emily was saying, that these home tests are pretty standard now. So I think if you call someone and say, do you do an at-home test? And they're like, no, well, then call somebody else, you know, and find someone that does. If you have a PPO, now if you have an HMO, contact your primary care physician, and I'm sure they will be happy to get your referral. If not, find a new freaking doctor, okay? Because if your doctor is not going to help coordinate your care, then you deserve better than that. So that's my whole.
Absolutely. Yeah. If you're getting that, oh, you don't have sleep apnea, you're thin, you're fit, you're a mom, you're just working too hard.
Find a new doctor.
Find a new doctor.
Yeah. Exactly. So for sure. And so we're going to have Emily back on as a follow-up in a couple of weeks. Once we, you know, fix Hunter, we're going to fix him. Sleeping better and all things. But if you're watching this on the replay, please ask your questions in the comments below. I know we have a ton of people on the call. I'm going to post this to my page. Please share this information in your story. I feel like it's just a really powerful message, especially for women who may not be getting the appropriate diagnosis to kind of help. I mean, because it is a simple fix, and could have a huge impact on so many areas of your life. So I was really passionate about it. But thank you so much, Emily.
Thank you. Yeah, thanks for having me. And I just want to leave you with, you know, I told you about Matt Walker. And I don't know if I can't remember if I shared my favorite quote of his, and he says, sleep is the elixir to life, right? And so I'm going to leave you all with that. Like, think about that. It truly is. It's the magic potion, right? It is the foundation on which health and wellness is built. We all think it's diet and exercise and this kind of thing, but honestly, if you are not sleeping well, it all goes out the window. So it truly is the foundation, along with the other lifestyle choices, right? But I just thank you so much, Amanda, for what you do every day. I love being part of the Lean community. I've been part of your community for 2 years, and I love it. And thanks for having me.
You're so welcome. So much information. And I will just say snaps, you know, to that, because again, when we talk about foundational work for your health, sleep is number one. Sleep is number one. So good job, guys. Okay.
Thank you.
Yes, I love it. I'll talk to you guys soon.
Okay, thanks.
Bye.
Bye. Sleep well.
Yeah, that's right.